This morning on BRN, avoiding the wait with virtual autism evaluations. Joining me now to discuss this and a lot more, Dr. Hokehe Echo of Glow Pediatrics. Dr. Echo, so great to see you. Thanks for joining us on the program this morning.
Thank you so much, Mr. Snyder, for having me. It's an honor.
Oh,
Thank you.
please call me Jeff. Mr. Snyder's my father. But in any event, really appreciate having you on. And as I was telling you in our virtual green room, autism is an important topic. I think a lot of people, a lot of families are facing the challenges of autism, and we cover it here on the network. I want to get your perspective because you launched a virtual clinic to help diagnose and treat autism. What led you to decide to do this and offer this service?
Yeah, great question. I call it my God moment. I mean, because it's not like I didn't realize that there was such a problem in my home state of Oklahoma, but it just came to the forefront of my mind, right? That children were waiting up 2 years and upwards just to get a medical diagnosis. And for me as a pediatrician, understanding how critical the first 5 years of life is in terms of early intervention, right? Because that's the period where the brain growth is the highest, right? And so if you're going to make changes with a child, especially something that's brain-based like autism, then you want to get in there and make these changes like therapies and whatever issues you need to address is best to address in the first 5 years of life. So to have children waiting 2, 3 years is unacceptable. So and that's why I started. And I started it as an in-person practice in Oklahoma. And then I realized, well, I kept getting calls from other states saying, are you in my state? Can you help me? Because I've been on the wait list for 3, 4 years. I mean, I've met a mom whose kid has been on a list for 8 years. And so I decided that I should do something about it. And so I started expanding beyond Oklahoma. And the way to do that was virtual. So that way, and we have a promise that we make to our patients is that we'll get you in and out within 2 weeks. So that you can get the process to getting all the services that the child needs in
Yeah,
place.
and sorry, I didn't mean to cut you off. I was going to say, just follow up and say, obviously, really important. I'm shocked, surprised that it takes that long to get a diagnosis. That's probably another topic for another show. But let's focus on the virtual clinic. And you said you expanded to many other states beyond your great state of Oklahoma. Where are you current? Where can people? In what states can people work with you? And are you going to be expanding to perhaps all 50 states in the District of Columbia and some of the other territories?
Great question. Yes. So right now we're in 10 states. Let me see if I can remember all of them. So Oklahoma, Maryland, Tennessee, Alabama, Arizona, Minnesota, Maryland, uh,
Georgia,
Georgia, yes,
you
and
mentioned New York, New Jersey, and
yeah.
Florida and Pennsylvania. I mean, so those are big. By the way, those are big states, and I don't want to put more work on your plate because you've got to do the work in the diagnosis. But do you see yourself for creating this virtual clinic that reaches across the entire United States?
Absolutely. And even global, because there's a global issue too. I've had people reaching out to
Sure.
me from other countries as well. So, and it's not just me. I have two amazing pediatricians who work with me as well. And so for right now, it's the three of us, but we are definitely looking to add in more states because we keep getting the calls of parents that just need the help for their children. And so, yes, we definitely have plans to expand across the nation.
And in terms of accessing the service, if I live in one of these states, you have to be in a state that you currently service because I'm assuming that's a registration and requirement, regulatory requirement. How do I gain access to the service, and is it covered by insurance?
So, yes, the way to access our services, easiest way is to either go on our website, which is glowpediatrics.com, or call our office and we will get you set up. And so we've made it pretty easy. We have a link on our website where people can go and schedule themselves, like do a self schedule for a 15-minute call where we assess if we can truly help. And then if it's a yes, then we go ahead and schedule the patients to get the evaluations done. And as for insurance, at this time, we're still out of network with insurances, but we offer multiple ways for parents to access the the evaluations and cover them, like HSA payments and things like that, which we go into detail on the website. But definitely we are open to working with parents and figuring out how we can make it work because we understand the importance. And insurance coverage does take a long time.
Yeah.
And so we just decided let's just start working and provide as many ways for parents to be able to access it. And that's what we've done. We provided at least 6 ways for parents to pay for the services. So
And I'm sure, I don't know if I want to hear from you, but I'm sure parents have shared their frustration at getting a diagnosis, but also their relief in being able to work with you. That's got to be an amazing feeling, and you probably get some pretty positive feedback there.
yes, especially on the days when I wake up, I'm like, this is a lot. And then, like, for example, yesterday, I had so many things going on, but then I talked to two parents and they were so overjoyed because one of them, her son had been waiting for 4 years for an evaluation. And now she gets the report, she can go to his school and he can get the support he needs at school, he can get access to therapies. And so they were really overjoyed. So it definitely makes my day. I think I get more out of it because it just gives me so much joy that that children can be on their way, and because whatever's going on with the child impacts the whole family, right? So now parents can do better at work because I try to look at it as a family thing. So it's not just the child we're helping, it's the whole family. And when we go past, I mean, we even after we do the evaluations, we provide integrative care. And what that simply means is, as an integrative pediatrician, I look at the whole child, right? So it's not just the symptoms. The question is, why is the child acting? Why is the child being aggressive? Has the child slept enough? And what's affecting the child's sleep? So I'm like a medical detective trying to figure out how can we address sleep? How can we address nutrition? Because all of those things affect behavior. And if your child isn't sleeping, which a lot of kids with autism don't sleep well, that means parents aren't sleeping. That means they're not showing up well at work. That means productivity is low. That means it affects the entire family. And so our goal and our mission at Glow Pediatrics is really the whole family. How can we get families moving forward in the right direction? So
Yeah, I mean, it's a great mission. That access is so important for any family who lives in one of these states that you service. My last question to you is, in terms of autism research, how have we just scratched the surface, or are we learning a lot in terms of causation? And it sounds like treatment, we have a good handle, like, in terms of how to, I don't want to say manage, because I don't think that sounds right. But, everyone has their own, we're all unique. And so it's just understanding how to work with an individual who has this.
yes, so research is definitely ongoing and we're always learning more. And as of right now, we haven't come up with one thing that causes autism. It's multifactorial.
Mhm.
There's the environment, there's the part nutrition plays, in creating the behaviors that we see as what we call autism, right? So from my vantage point as an integrative pediatrician, there's so much research that shows that the gut and the brain are directly connected, right? So if for example, I've seen this so many times, a child is so constipated that they are not sleeping well and they are more aggressive. And so instead of just saying, oh, you're aggressive, here's medication. I'm not against medication, but what if we ask the question, what else is going on with the child that could be impacting and increasing their aggressive behavior? And so I found in my experience when and this is research based as well, when you work on the gut health of the child, so relieving that constipation, working on whatever else is going on with the child there, like any digestive issues, which children with autism often have a lot of digestive issues. If those are addressed, you will see a shift in the way the child behaves because the brain and the gut are connected, right? And so whatever helps the gut will improve the brain health and thus will improve behaviors that you see. So you can take a child that's really aggressive and constipated and doesn't sleep, which, by the way, if you don't sleep, you're not going to act right, right? If you think of us as adults, if we don't sleep,
Absolutely.
we're so irritable. So can you imagine what a child that cannot express themselves is feeling, right? Because they can't sleep, they can't shut down. And so it's helping those three big areas. And I have seen children go from being aggressive to being like more compliant, will listen, will follow directions, and they are able to do much better in therapy, right? Because it's a triad. It's the medical part, the therapy part, and the environment. And so if we address those three areas, definitely we can see an improvement in the child, and their trajectory of life definitely improves, and the family as well. I always like to add. So yes.
Yeah. Yeah, I mean, I think. Look, I believe in that things are integrated. I personally believe that things are integrated, and it seems like medicine is starting to follow or has followed that trajectory. You're doing great work. I think you're offering a lot of relief to parents, to families. Keep up the great work, and look, we look forward to having you back on the program again very soon. Thank you so much, Dr. Echo, for having us on the for joining us on the program this morning.
My pleasure. Thank you for having me.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, are at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.